The DISIS medical imaging system presents to us a much greater and accurate evaluation of the cervix and the presence of HPV-related disease. Years and years have been, colposcopy has been utilized for this, but only using the naked eye. And that's the issue. The issue is that that's not good enough. A case in point is a young 24-year-old female who has never had a child, presented with a pap smear that just said atypical cells of undetermined significance, but positive for a high-risk virus. The routine at that point is to offer colposcopy, which was done, and she was also offered the DISIS colposcopy evaluation. The colposcopy by my eye showed some high-grade changes, but DISIS said, okay, there's a spot over here I want you to be careful with, and by its coloring that it does in greens and reds and yellows. And when we biopsied this, surprisingly enough, my biopsy was a high-grade lesion, but her biopsy came back adenocarcinoma in situ of the cervix, for a young woman of age 24, this is highly significant, and required advanced treatments, and she is now free of disease. But had the DISIS not been utilized in this patient, I worry that we may have missed this. DISIS will probably become the standard of care, primarily because of its increased sensitivity to abnormal findings. It does offer us the chance to more completely evaluate things, to make sure that we're not missing something that the cytologist may have missed. Sometimes the skill of the practitioner in taking a pap smear is in question. So it really does help us to more thoroughly, completely, and to the highest degree of technology offer the patient the best care possible.